I would just like to thank all of you who are on at the moment. Thank you for us joining our second part of Suffering with Alopecia. My name is Hannah Stewart. I've been a sufferer for the last 22 years. But I'm not going to talk much about me. I'm going to let the speakers I've asked to come on to speak about themselves. We have Miss Bella, we have Miss Chanel, and we have Miss Jennifer Soler online. And seeing as Bella's name starts with B, I'm going to ask her to kick off. Introduce yourself, Bella, please. Thank you.
Thanks. I was going to do a crafty. Evening, everybody. I'm Bella. That's it. Not really. I'm Bella. Known Hannah for quite a while. She asked me to come on and talk about the issues that I had with my hair, which it's not alopecia. So it's kind of cross between getting plaits done and hormones. Do you want me to continue or you want to introduce first? Okay.
Continue, please.
So I actually discovered that I had the loss of hair and it wasn't regrowing when I had my first ever extensions done when I went away to Gambia the first time in 2008. And at that point I had plaits right here everywhere, all full, similar to Chanel, just long, a whole long mane of plaits. And I wasn't used to having my hair in plaits, and certainly not that long. And obviously we went in what was our autumn. We came back in the winter. So whilst I was out there wearing just tops and everything loose and lovely, but then I came back here and then I had to be putting on jumpers and all of that. And whilst I was putting jumpers on, I wasn't doing the Miss Delicate lady and all of this hands through the top. On what I then discovered over a period of time, and the plaits came out and etc., and then just a natural blah blah blah, was that I developed this piece here, which is similar to like the male kind of pattern of baldness. So this thinned off completely, that top bit, and it's a case of, I mean, I've had my hair longer since. I've had it twists, natural twists, and I've done it myself. But that middle piece there has always been the bugbear. And I've tried loads of natural stuff, lots of oils, lots of natural bits and bobs, supplements, things that are supposed to help your nails and your hair. And this is why I say I believe, for me personally, that it's part hormonal, with the hormone changes during the menopause as well, because it hasn't just taken back growing. All of this will grow back, and this bit will still be left looking and shiny, really shiny. But just of late, I have to say, my son was getting some hair produce from America, and he bought me the hair grease, and I've been using it, and I've actually been able to start feeling that there's hair coming back to there. So fingers crossed, it's working.
Good.
So that's all I can say, really. I mean, I can do my own, just shave down. I leave this little bit at the front there just for the hell of it. It won't stay there. But I find that the changes with our hormones, our hair, our nails, and it's not just a mood swing thing, the hormone. And that's my little contribution.
Thank you, Bella. Thank you for coming on, and thank you for sharing. I'm going to introduce Chanel. Chanel suffers with hair loss, and I believe that Chanel is also a sickle cell sufferer. So Chanel, will you introduce yourself for me, please?
Hi, good evening, everyone, and thank you, Hannah, for asking me to speak today. My name is Chanel, and I do suffer from sickle cell, and I also receive regular blood transfusions. And I also suffer from alopecia. What I will say is I've never really spoken on my alopecia. So today will probably be the first time that I'm actually sharing my experience on my alopecia. And I guess I'm grateful to Hannah because I saw, you know, a post, I think it was from Sherelle, and I saw the first, you know, live or event that you'd done, and you speaking on your alopecia, and I felt like it was really brave. And I felt like we don't, well, us as Black people especially, we don't really speak about our alopecia. So I found it really compelling as well that you was able to share, you know, your story. So I guess it's also given me, you know, the strength to also come out and, you know, share what I've been going through also as well. So me having sickle cell and taking regular medication, you know, having sickle cell kind of stresses you out, and stress is a big trigger. So I remember, you know, around 16, when I had my hair braided for the first time, but it was like braided like in a ponytail type thing in single plaits. But I remember like there was like a bald patch on my right hand side, and I didn't know what it was. But I remember it kind of stuck out, but because my hair was quite thick at the time, you would have to, you know, see really, really close up to see, you know, it was a bald patch. But to me, I felt and I could see it. Over the years, I just kind of ignored it, to be honest with you. And my hairstyles were relatively okay. I didn't have enough, you know, I didn't have hairstyles that were pulling on my scalp or the sides or anything like that. My mum was pretty old school, so grew up with like the doo-doo braids and, you know, the thread in the hair as well, half Ghanaian and half Jamaican. So my mum from the African side would thread my hair. But I guess me having sickle cell, going through pain, what I used to do, I didn't realize I used to do it as well. I used to like pull on my hair when I was nervous, or pull on my hair when I was in pain. And just growing up and over the years and having my hair done, one day I just saw like a big patch on my right hand side. So the patch that was small to begin with had come relatively big. And I guess I was so embarrassed about it, I just ignored it. I just ignored it literally. And I ignored it because having sickle cell has its own challenges. So I just felt really embarrassed to even speak about it. So whenever I would go to hairdressers, I had one particular hairdresser, and I've had the same hairdresser practically all my life. And I feel comfortable with that hairdresser. So me going to my hairdresser, you know, there was always that comfortability, but I would always go and, you know, book my appointments beforehand, but book it in a way where it was only me and my hairdresser in the salon, because I was so embarrassed, you know, if someone was to see the other side of my hair, basically. In 2016, I was on some medication called hydroxy for sickle cell. And it's not really a good medication to be on, but there's many side effects to it. And it's a chemotherapy drug, which is used for cancer patients. So as part of my treatment, I was offered those, you know, that sort of treatment, the hydroxy treatment, and I was taking it for a year and a half. But what I'd started to realize was there are many side effects, and some of the side effects is hair loss, hair thinning, and breaking out, hormonal breakouts in your skin. That all happened to me. And I realized that while my hair was growing, it was thinning at the same time, because what I would usually do is do cane rolls and maybe wear a wig, or have my hair like half up, half down, or have, you know, leave out basically, so that I wasn't putting any tension on my edges or anything like that. With that medication, my hair just deteriorated dramatically, and literally hairstyles wasn't an option for me. So I went to speak to my doctor, and my doctor referred me to the dermatologist. When I got referred to the dermatologist, they basically asked for me to have a biopsy done on my scalp. So that was done in 2016. I had a biopsy done on my scalp, and the results came back. It was alopecia, but I can't pronounce it. It's traction alopecia, but it's the one with the C attached to it as well. and they basically told me that there was nothing that they could do about it because my patch got so big that I just ignored it. And there's, you wouldn't be able to tell my patch unless I show it to you, but my hair's quite thick at the front, so I'm able to cover it. But I considered, hair transplants and everything, hence why I went to my doctor. So me having the biopsy and me being diagnosed with the alopecia, which I knew I had alopecia, I guess for me, it was to see if my hair would ever grow back. And no, my hair hasn't grown back or anything, but I do, I've just like, the first speaker said, I've tried oils, tried, different things, and it still doesn't, it's still not growing back. But there's this one oil that I've tried recently, and it's called Planted, and I've been using it for the last like 2-3 months, and slowly but gradually I'm seeing like hair follicles coming back. But at the same time, I'm just still a bit hopeful that, I'm able to speak to you guys today and probably seek further advice and see, if anyone else has got any tips as well. But yeah, that's my story.
With the hydroxyurea, Chanel, what go over it again. What did did you lose hair because of the hydroxyurea?
Yeah, so with the hydroxyurea, there's some of the side effects. It does say it causes you to lose hair, like causes your hair to thin. And what I'd done was I used to take pictures, whenever I do my hair, I would just make sure that I take pictures just to see if I'm taking, if I'm using any, strain or tension on my hair. With the hydroxyurea, literally it thinned out my hair so much, so badly. And I knew it was that as well, because as soon as I stopped the hydroxyurea, my hair started to, come back fuller in those areas.
Okay, thanks a lot for that, Chanel. We do have a trichologist online who I'm going to introduce towards the end of all the speakers speaking, and she will be readily available to answer questions that she can. And my next speaker will be Jennifer Soler. Can you introduce yourself, please, Jenny?
Hello. Can you hear me?
Yes, we can.
Oh, okay. Hi. Sorry. Yeah, so I'm Jennifer Soler, Jenny Soler. Yeah, I've got alopecia actually. On the top of my head. Is it the crown you call it? Is that the crown, Han? Yeah.
Yeah.
So yeah, just to inspire people actually. So Hannah shaved her hair. Me and Hannah were best friends. She shaved her hair. She gave me a call, and I saw how wonderful she looked. So I followed her to the barber's. So what I thought I was having a little trim. But anyway, he shaved me straight off like Hannah, clean, clean, clean. And I just want to inspire people. I mean, I hated it, as Hannah knows. I thought, oh my gosh, I look terrible. My dad wasn't supportive. My mum laughed. It was awful. But I started to walk the streets with boldness and, a little bit of makeup and big earrings. And I started to get all this attention. I was like, oh, wow. And, it was black, white, male, female, just coming up to me and say that you look wonderful. But for me, so I can dress a bald head, and I've tried like everybody else, everything that you can think of. I'm not going to buy any more stuff. I'm refusing. My hair is my hair. I'm just a bit like I think it was Chanel. So my hair is thick in lots of places, so I can hide it if I need be. So right now I'm sporting a few cane rows, and I quite like that. So yeah, alopecia is alopecia. Mine, they said, was from tension, so pulling up the hair to wear wig caps, and I would insist that they're sewn down because I didn't want them to come off in the night. So that didn't help. So all my hairline and the patch on the middle is still there. So yeah, alopecia is very topical. A lot of us feel better. Didn't know I was speaking today, so I'll have words with Hannah later. But yeah, go on, ladies. Yeah, we are who we are. Everyone's got beauty within them. And like I said, I didn't see that for myself at first, but my bald head, I swagged it. And there's lots of stars that you can swag your alopecia as well. So, yeah.
Got you.
Sorry? Hello, it's me. Is that a question to me or Hannah? Is that
Hannah's muted. Hannah, you're muted.
I was telling you to continue, Jenny.
Oh, okay. No, so that's all I was saying actually. So yeah, I was just saying good luck, and that we've all got our beauties within us. We just got to embrace it and look at it in the way that it is. So yeah, yeah, there's not much more to say. Don't know if anyone's got any questions.
We were supposed to have a young man online, but he looks like he may have chickened out. So I'm going to tell you a little bit about my hair loss. My hair loss started about 22 years ago. Most people know that I have a 35-year-old who's a sickle cell sufferer. Cheryl became really ill 22 years ago, and I didn't realize that from worrying from her illness, I started to lose hair. And like we as Black women do, we wear the weaves, we wear the plaits. And if you're anything like me, when I wear a weave, I leave my weaves on for months. And what you don't realize is that the longer you leave the weave on, the further back your hairline goes. And that was me. It got to the point where I was really embarrassed about my hair, especially the crown, the bald patch in the middle. Before I started shaving, I would wrap my hair. And I remember one of my embarrassing moments was going to get my eyelashes done. And I used to I wrap my hair and have a big knot in the front. And the technician accidentally was leaning on the knot, and I could feel the scarf coming up, and I could feel my face getting redder and redder and redder with embarrassment. And I had to make a decision. I couldn't continue that way. I'm very, very fortunate. I have a very good barber who's online at the moment from Main Culture called Kevin. Kevin used to always talk me through, sis, you have a lovely face, Empress, cut down the hair, man, blah, blah, blah. Until one day I made a decision and I went and I sat in his chair and he shaved me off, and I've never kind of looked back. It's made me bold, but I would not let my hair grow to a certain length. Sorry, someone's trying to get into the waiting room. I would not, once my hair grew to a certain length, I would either wrap it or I would cut it. Because of that deep, shiny spot in the middle. When you let the hair grow around here, it's like someone's taking a lawnmower, just going, shh. And that to me was what really upset me. That was the embarrassing thing for me. But I'm a Christian, and the Lord said to me, well, if you're giving me all of me, you've got to give the public all of you too. You've got to let them know what you're going through. So after doing my broadcast one Monday morning, he said to me, show your hair, take a picture, show your hair, which is what I did. And talking to Kevin and talking to another sister, we decided to go live one day, that was the first time we went live. And so many women responded to me, sis, you're really brave. And to me, it's not about being brave. I had to love myself from within, because I used to look at the mirror and see ugly. Because we're in a society where they make you believe that unless you've got hair on your head, you don't look good. You know, if you wear your own hair, what they call nappy hair, that don't look good. Your hair's either got to be straight, long on your back, whatever. So I had to embrace who I was, that my hair didn't define me. My hair was just part of me, because we grow up hearing people say, oh, your hair's your beauty, your eyebrows is this and your eyelashes that. So we're kind of brainwashed in a way. So I went out there and I was just encouraging other Black women to love yourself from within. There's a lot of women that I know that have partners or husbands, and their partners or husbands have never seen their bald patches. Because as women, we've already made up a story that how if I show the man my hair, he's going to say X, Y, Z. So we've become judge and jury before we've even had a discussion with him, before we've even shown him the hair. And what we think in our minds is probably not the response that they would actually give us. So I'm just here to encourage people. It's a process. It doesn't happen overnight. But I'm here to encourage any Black woman, any Asian woman that's going through alopecia to embrace who you are. Your hair doesn't define you. Your heart defines you. Your character defines you. But we've all got to go through stages in our life where we have to accept who we are. And I've accepted this is me. Hairdresser said to me, Hannah, I can see little hair follicles like Sister Chanel, I can see little hair follicles coming through, but it's taking its time. So while it's taking its time, I'm either going to shave off my head or wear a wrap. Now I'm 59, so like, you know, once you hit 55, you start getting the hot sweats and the menopause kicks in. That's me right now. So I can't really take too many things on my head. So wearing my hair bald is fine for me. And maybe one day the hair will grow back. But right about now, I'm embracing who I am. And I no longer see ugly. I just see Hannah. I just see Hannah with really short hair. So I'm going to introduce my barber, Kevin. Kevin, can you unmute yourself, please?
Yeah, hello guys, good evening. Good evening to all. Can you guys hear me?
Evening.
Good evening.
Good evening.
Good evening.
Good evening, yeah.
And thanks for having me on board today once again. Yeah, what I can say to you ladies today is you're all beautiful within yourselves. And it's been to be able to step out today and explain your story is a big step. You know what I'm saying? And we hoping that it will be able to help you and help others. Hannah started something great here. And just wish that she will be able to keep going on and on with this so that she'll be able to help others. Very brave woman, very beautiful person also. The first time I met her, as she said, we had problems with her being able to accept the hair loss, and I was able to convince her to get rid of it. She still looks beautiful, and up to this day, she continues to wear the very low look. Looks amazing. I have a lot of young people also coming to my barbershop who suffer with this problem, alopecia. A lot of them stressed out because of studying and stuff. But eventually, after a while, their hair repairs on its own. Ladies, well, in my hairdressers, I know a lot of them who suffered with it and suffering with it. And well, if you ever come into my store, it's ladies and men together. So sometimes you could see women feeling a bit shy to expose themselves, you know, but they tend to, my staff, we tend to gel with each other. Eventually, everybody feel comfortable as a family and things work out, you know. But Hannah is such an amazing woman to come out with this idea to try and build people around and make sure that they feel good within themselves, you know. There's so many different type of alopecia, and I'm here to learn about it right now as we speak. I've been learning, listening to everybody speak so far. Sorry. What can I say? Thank you for having me here, Hannah. And thank you for doing what you're doing.
Thank you.
All right.
Thank you very much.
Good
Is
evening, ladies.
Shirley McDonald? Shirley McDonald? Shirley, you there, sis?
I am here.
You want to introduce yourself?
Hi, everyone.
Let people know who you are and what you do.
Yeah. So I'm a trichologist. I have actually met Kevin before, and I know Linda, who's on here already. So it's nice to see a couple of faces that I know. I qualified as a trichologist in 1991. So I've moved from the Midlands, moved to London to train as a trichologist. And if you like, trichology has become very sexy at the moment. You know, a lot of people are training to do that. And it's, if you like, a subset of dermatology, but we only focus on the hair and scalp. One of our issues, which we're trying to change, is that anyone can call themselves a trichologist. So you really need to have a good look. If you're going to see one, you know, have a look at registers and see what the training is like beforehand. And we deal solely with hair and scalp. So we cover everything. And I'm listening to some of you. I've made some notes as well, because there's some interesting things that you're saying, and you have a sense of what it is. Historically, with dermatology, I don't know if you know this, but GPs aren't trained in hair and scalp at all. During their medical training, they may opt never to do anything. Certainly, they'll do 2 weeks max of dermatology, but nothing in hair and scalp. So sometimes they're not always as sympathetic as you'd like. We say hair and scalp is the barometer of your health. So if you see something wrong with your hair, it can be an indication something else is going on. So it seems strange that it gets ignored. And that's not all GPs. Some of our patients are GPs as well. So you can see that there needs to be more of us doing this kind of work. The other issue that people may have experienced is when dermatology came about, there's two things: the skin typing. So they regard black skin, there's 6 color types. I don't know if you've heard of Fitzpatrick skin typing. So 1 being the very lightest, 6 being the very darkest. So when you go and see your doctor or your dermatologist and they're looking at the skin, one of the things they may look for is inflammation. Now, on white skin, inflammation may present as redness, but that's not going to be the case in black skin. So sometimes things get missed. We're often told that things are traction when they're not. So, you know, there's all these issues. It is changing. We're trying to make sure that people are up to date. And there are some people in the industry who are really pushing for that. There's actually about 30 something skin types. Hannah, do you want me to go on?
Please do, because you're going to educate all of us here that are sufferers.
Okay, please interrupt me anytime if you want to ask some questions, but I just want to give you a couple of stats. COVID, there was a recent research project, 100, and given that COVID's affected Black people the most, as they say, 130 images, not one of us was in there, and yet it's affected our skin the most, not one image. In dermatology books, when you look, it's often anything that's related. This sounds very crude, but not crude in what I'm saying, but it's a crude measurement. Majority of the things in the books often allude to, if it's a sexual transmission, transmitted disease, it will be a Black person that they'll show. So you can see how certain biases creep in to diagnosis as well, and that needs to change. They also, we're mixing much more, so we believe now that there's more than 30 skin types. What else can I tell you about that? Yeah, there's one condition, it's a scarring one. In white people, it would be purple. In a Black skin, it's going to be very dark brown. So we have markers that we look at to be able to pick things up. Just touching on the first speaker, was that Biz?
Bella.
Bella, sorry, Bella.
That's all right.
yeah, you were talking about your hair loss, and you mentioned that it was in the middle of the scalp. And I think, without seeing you, I can't diagnose, but it sounds
here anyway.
Yeah, it sounds very much that. You need to see what's going on with mom and dad, but you may have a kind of genetic hair loss along with a scarring one that runs with, we see a lot in Black women. I'll speak about that one a bit more, but you can have 2-3 things coexisting often.
I did have, I didn't mention about like getting originally afterwards as the years went on, because it started in 2000, just after 2008. And I'd had like relaxers done. And then I had this scalp thing that came up. And that was just like, you could scratch your head for days. It was like that.
Yeah.
And that was supposed to have been burnt. I had lots of treatment, medical treatment from the hospital. But it's kind of like, it really doesn't bother me, because, I mean, Hannah can tell you, she's seen me with longer hair, shorter hair. I've done bald. The only reason why it's not bald is because I'm just showing off. Look.
Yeah,
I don't
very
care.
nice it looks.
I colour that piece. Yeah.
Yeah.
So I'm the advert for wash and go, because I do wash and I'm done. It is easy, but my bugbear is the fact that, as Hannah said, Chanel said, you can feel the hair follicles, you can see it, and you get all excited, but then you got to wait for this to catch up with the rest. So you still got to do something about the rest of it. Yeah.
Perhaps if I gave you,
if I'd have remembered, I would have done some photos. But I mean, Hannah would have seen it, or anybody. I don't think anybody else here is friends with me on Facebook. But from years back, you will see there's different pictures of me where my hair was in twists, and that was my natural hair down to here, fine, and I could twist it myself and all of that. Do you know what I mean?
Yeah.
Look.
Yeah, sure. I think perhaps what might help is if I explain the categories, because that will give you an idea of where maybe it fits. So generally speaking, I'm just referring this, I can talk for England, and what I really don't want to do is go off topic. But if you just put it into broad measurements, alopecia is really a generic term. So we use it, it just means hair loss. But we use a prefix or a suffix at the end to determine what it is. So areata means area of loss, totalis obviously when it's all the head, and universalis is when it's complete body. And there are other types. I saw someone yesterday who had aphasis, and we see that in young people where they lose it around the, we'd say occipital, around this nape area here. Generally speaking, if you get that type of hair loss, the prognosis can be good if you can attribute it to something happening, say in the last 6-12 months. So you've had a bereavement or an operation, I've had it, and then you get these patches of loss. So spontaneous loss, spontaneous recovery, generally speaking. The other one is what most people know, we call it female or male patterning, where you lose it here. So women thin, and men, it's a recession. And that's determined by your genes, either parent, mom, dad, grand, it can come from any side, hormones, and also your age. So that will determine that. And then the other big one, which is, I think Chanel mentioned it, was the cicatricial scarring. Yeah. So again, that's the word for scarring. And that one's slightly more tricky, because with the alopecia areatas and those, what's happening, if I can show you something, I need to just pop up here. Sorry, I haven't got a very place to sort of show you, sorry, a makeshift. So I brought this along. So this is our hair. These are the layers of the skin. And so this is a hair follicle, you know, so this is all what's going on down here, the lower part. When you have something like alopecia areata, which is usually autoimmune, we don't know why this one triggers, but we know it's usually from trauma. So something happens, 6 to 12 months later, hair's gone. Well, down here, down the bottom, is where you've got all your fewer stem cells and you've got your capillary network. So with this can repair at any time, because with those autoimmune, it's your body saying, I need to protect you, something's going on, so it shuts it off. It attacks the, you have lymphocytes, white blood cells, and they destroy the hair follicle. But once the assault is over, that will regrow. The problem with scarring conditions is that it happens here in this, just beneath the skin. And this is where your sebaceous gland is. And that, you know, when you get cold and that erectile, you get goosebumps, you get that muscle here. Well, most of your stem cells for hair is located here. And that's the issue. Once these get destroyed, they don't always regenerate. So this is why this is the problem with this. Now, people talk about they can feel it. Imagine that you've damaged that area. Each time you're doing that, it's getting thinner and thinner and thinner. It's just getting more traumatized. So this would normally be what we call a terminal hair, but it then becomes a vellus hair, a very thin hair. Like when babies are born, you know, you get that very thin hair that's on there. So that's what's happening. So it is harder. That said, there are things that you can do. Things have moved on. I would say that if it's happened, you usually get a 2-year window. So if you can get in there and do treatments, avoidance, and, you know, change your routine, then you've got a good chance of recovery. I don't know why, but I find that the patients that continue to have, you know, like steam their hair, do treatments, it really does help. Whether it's placebo, you know, you just feel like you're doing something, but it does seem to help. And I would say, yes, it depends how far you want to go. There are things that they can use, but you have to be mindful. But I have had patients where after 2 years, they've had regrowth. It's never the density that they had before, but sometimes they get some coverage enough to feel, you know, to be able to camouflage it and feel comfortable, because everyone's different. Perhaps I can ask anybody any questions that you wanted to ask me. Yeah. Some of the scaly conditions, you can lose the hair, but that usually recovers.
So
I'd like to ask a question, actually, if I can. Can you hear me? Sorry.
I can, Jenny.
Yeah. When I went to the doctor with my hair loss and my alopecia, and I felt that the doctor was very dismissive.
Yeah.
You know, they didn't. I wasn't. You talked about they look at your scalpel. They give you. She didn't even look at my hair. She didn't look at my head. She didn't look at nothing. She just dismissed me.
Yeah.
You know, I did some research. Yeah. I was on blood pressure tablets at the time, and I said, look, these blood pressure tablets, that, you know, one of the side effects is hair thinning. But she just, I can't remember what she said, but she was very dismissive, and I wondered if there's a way that we can change this dismissive attitude, because if there's a 2-year window, then, you know, some kind of support would have been welcome at the time. I've gone beyond the 2 years, so yeah. And I've got to say that my hair loss, I noticed, is inherited. There are female aunties on my dad's side. My mum's got a full head of hair, beautiful hair. But on my dad's side, there are 3 aunties, all from the same mother and father, with the same hair loss as me. I hate to admit it, because I want to have my hair like my mum. She's got lots of hair, beautiful hair. But on my dad's side, the female have adopted that, actually.
Yeah. The one that you're talking about, particularly if you lose it in the middle, it's a condition that we see in Black women, some men, and it's called central centrifugal cicatricial alopecia. And really what it means is vertex loss. So it starts here, and it's from a defective protein gene that was discovered in 2019 by a Black South African dermatologist, Dr. DeLover. And she's doing lots of promotion now to help, because with a lot of things that concern us, there's not always the interest in doing research. But we know that that runs in families, and we know that we've always known it's been triggered by hair practices. So in the 50s, it was called hot comb alopecia, and then it changed its name again and again to, what was it called? Degenerative, I can't remember the name off the top of my head now, but we call it simply vertex scarring. But CCCA is what you will hear them refer to. And I've had good results with it, but it depends when it is. To get people, what we're trying to do, I've spoken at a GP surgery before, I've been asked to go in, but what we're saying to them, and I teach for the Institute, and I say to the students who are white or, you know, non-Black, is that you've got to show confidence in the patient. You've got to be that person that they can look to and answer your questions. But if you're shying away from it, you know, and if you want to get compliance, then you have to understand our needs, you know, that our hair is dry and that we need things, you know, and I give them tips. So you're right, it is difficult, but they don't have any training. I sit on the dermatology council as well, and dermatology as a whole doesn't get a lot of the funding or any of the input. And in dermatology, they're more concerned with skin cancers than they are with hair. So it's a battle. But we're definitely doing things. We've applied now our institute to the PSA, Professional Standards Authority, so that we can be listed as an ally health profession. And what that means is GPs would then be able to refer to us. So the application's just gone in, and we've also been centre approved for our qualification as well. So definitely heading in the right direction.
Thank you.
Shirley, what could you recommend for someone like me that's had hair loss for 22 years? What can I do at home to help regain some hair or growth?
I don't know, and I would be saying to you, if it's been that length of time, when I work with patients, I tend to try and do a lot through nutrition. But nutrition is, I always feel it's more maintenance sometimes. When things are acute, you need modern medicine. And so the work probably should have been done at the beginning, and they should have used what we call rubificient, sort of irritate the area, so you bring blood to the circulation. So something like menthol, if it's weak, it can be calming, but if it's strong, it can stimulate, it can irritate. But after 22 years, it's really, really sad, but we would say to you, do what you're doing, you know, wash things, but try and relax from the whole thing. But the prognosis is not as favorable because of the length of time that you've been there. With scarring conditions, once they've settled, depending how much hair you've got left, you can at least have hair transplants.
Considering that one time.
How much hair have you got? Where have you got hair? I know you're shaving the rest of it.
My hair loss is here, the middle, like Bella's.
Yeah. So if you can grow up there, they can do that. And with our hair, it tends to be, we get more out of it because it's curly. So you need less implants. So it tends to be a little bit cheaper, it can be cheaper for us, but they then need to know whether you would scar or not.
Because Black people, so we have, what do they call that scarring that we get?
Keloid.
Yeah,
so keloids.
Be careful.
Yeah, but they would test. they would test, they wouldn't just do it. There is one more condition that I think would be good to let you also be aware of, and this is where they're blaming traction, and it's called frontal fibrosing alopecia. I'm not sure if you've heard of that one, but it's a band-like hair loss across the front. And here's the thing, it's common in postmenopausal women and affluent women. And you might say, well, why would it be affluent women? Postmenopausal, you probably understand. But what the researchers have found is it could be related, they don't all agree, could be related to the sunscreens, the chemical in the sun protection. So one is that's often in there is avobenzo or oxybenzo, and these two are in there. Do you know what, back in the day when you used to buy sunscreen and you get that chalky white look? I don't know if you remember that. If you put suntan lotion on, you would get like a pinky white streak. This is what these chemicals are for, to stop that happening. But there is a belief that they are hormone disruptors. And so there would also be in moisturizers, and affluent women, the theory goes, would be more inclined to moisturize. And so it's this area, can affect men as well. So we're seeing more. The first one was noted in, I think, around 1994. And since then, there's been an explosion of it. Every week in clinic, you're seeing it. But certain parts of the country, it's more prevalent. So my colleagues in Surrey, Cambridge, every day they're getting people in with that. I tend to see more white women, but black women also have it. And vitamin D, I would say to all of you, please, please, whatever you do, vitamin D is a must. We could tolerate the darker the skin probably up to 7,000 a day through winter. I'm not suggesting that you take that because you need to be seen, but I would certainly say 1,000 or 2,000 a day over winter is beneficial, because if that's low, you lose your hair follicle immune privilege. Okay. So you really need to do that. Omega fats is the other one, but again, some patients don't tolerate fats that well because their system is so unwell. You might need to do some other work before you get there with that. Tyrosine is an amino acid that's also been recommended for people with the alopecias areata, totalis and universal. So Hannah, that's one that you can also try. And that's quite safe, but don't take it near in the evening. Okay. Because some people, it keeps them awake, but it's also good for stress.
Shirley, I was actually going to say as well, sorry to interrupt, that iron is also another thing to look at as well.
Okay.
Yeah.
So, yeah. Hair growth.
Yeah. Yeah. And that's more with a diffused hair loss. But fortunately, with most of the diffused hair loss, they're normally temporary. So with COVID, we've had a lot of patients with a condition called telogen effluvium. And if it's acute, well, literally everything goes, but you're not bald. It just goes to the very, very short. It's hair all over, but very short. We don't treat because we know it's cause and effect. So the hair will just regrow completely normal, no issues. But if it's chronic, which is 6 months or more, then we'll do blood tests. Linda, you're absolutely right. Iron, thyroid as well, we'll look at vitamin D, and there are other things that we look at. Problem with thyroid is in this country, the measurements are very different. It's in the States, in this country, if your thyroid stimulating hormone is around 4.5 to 5, then they'll start looking at giving you medication or checking, doing other tests. In the States, it's 2.2. So you see the disparity. Is it because in America you got insurance and they want to act quickly, more drugs, more money, or is it that they're just much more switched on to it? There's so much. Yeah.
Does anybody have any questions for Shirley?
Yeah, can I just ask? Hello.
Hi.
Hi. Should we be taking zinc?
Yeah, zinc is also a good one. It's the trace mineral, so you don't need too much, but that's also, particularly if you have things like psoriasis as well, and areata, zinc's a really good one. Yeah.
Okay.
Everything's important. That's the issue. I know we've got lots of vegans out there and vegetarians, but again, they're the people that we've always had the vegetarians. I think, and a lot of my colleagues think that some of these things suit particular people, but it doesn't suit everyone. So we've gained a lot of vegans with hair loss. And it's the one Linda mentioned, the kind of where the iron drops. Problem is it's the stored iron, which is serum ferritin. And if you're in population norm, which runs from 20 to 300 unit grams, then they're going to tell you you're okay. But for a trichologist, we would want you to be around 70 to 90 at least, because we know for a lot of women, if it drops below that, then they get the hair shedding. Mine always stays at 50 because I've had my thyroid removed like 20 odd years ago, but it doesn't affect my hair in the same way, whereas another woman it might do. So it varies. So I'm not saying you have to be at that level. It really depends. Anyone got any more questions?
I think, Sister Pauline, are you there?
Yes,
got you up there.
Sister Pauline, do you have any questions for the trichologist?
No, I'm just listening because mine is to do with trauma. I lost my son 4 years ago, and I did have plaits, and then they all start falling out one by one. So I've got nothing up the top here now, but the back really grows a lot.
Yeah.
But
you can try. Have you tried minoxidil? Has anyone tried minoxidil?
No. What is that?
Yeah, it's a topical lotion. I'm not saying everyone should run out and do it, because you need to really know and you have to manage expectations. But it was originally for blood hypertension. And they found that when it dripped onto the skin, it caused hirsutism, in other words, hair growth. So it's licensed as a topical lotion. So that's good.
What's it called?
Minoxidil.
DEL.
Shall I put it in the chat?
Yes, please.
Yeah, it would be helpful if you put it in the chat, and because although I've said I've tried everything, but yeah, I can try again. I can keep trying.
So if so things to tell you about minoxidil first is that you need to try it for at least 9 months to 12 months before you can say it hasn't worked. In the first few weeks, you're going to lose some hair because that's how it works.
Oh, no.
Yeah,
No.
you're going to have some hair shedding. And if you've got some hair shedding, that's good news. You have different cycles. You've got your growth cycle, your rest, shedding cycle, and then you've got your transition. There's a couple of other ones as well. What happens with minoxidil, it holds the hair in the growing phase. So all the hairs that were due to shed, it will prematurely just push those out, if that makes sense. And then you will have those. Around a third of people that use minoxidil will get some regrowth and maintain what they've got. Another third roughly will get nothing at all, complete waste of money. And then another third, it will just maintain what you've got. So it varies. We often use it sometimes as springboard. So Hannah, that's something that you could try.
I wouldn't mind trying it in the middle.
Yeah.
And it itches like mad as well. Is that part of the condition?
What, your scalp?
Yeah.
In the middle?
Yeah.
Yeah, that means it's still active. So when you have that irritation, then the blood vessels, the capillary network underneath is still active. So that's good, because you could then get some, you want that so that it could regrow. So, but it's when it, and the burning is also part of it. Whenever you get burning and itching, the problem is if it continues like that, then it will scar. So on one hand, you want it because then we can get in and do the treatment. I tend we've got to get rid of the inflammation. But when we have that, when you present in the early stages, that's good news for me, because it means I can do something with it. But when it burns out, like people say, it used to, but now it's fine, then you're kind of thinking, okay, it may not recover in the same way. So minoxidil is definitely worth a try, but you have to 9 months to a year. And if the foam is, it doesn't have what we call propylene glycol in there. So it doesn't, if you've got sensitive skin, go for the foam.
Okay.
It'll be a bit more expensive.
Does it come in different strengths?
Yeah, 2% is what women should start with, and men 5%. I don't give anybody 2%. I start everyone on 5. So I just feel like it's a waste. I just want to get in and get doing that. But sometimes I don't always rush in. I like to do treatments sometimes, because the treatments can yield you results without you having to depend on that.
Do we need to have a consultation? Are you London based? Where are you?
London and Birmingham, but yeah, normally consultation, you can buy minoxidil, you know, anywhere that you want, but usually you do. There's now a genetic test that we've got to sort of tell you what things would be useful. Anyone heard of finasteride? No. Spironolactone? Okay, so if it's genetic, you can take a DHT blocker. So when it's the, you know, they're thinning hair from male patterning or female patterning from hormones and that, then there is a tablet that you can take. Women would take spironolactone, but for women it's off license. But men take it. There are some side effects. Doesn't affect everyone, but we would not give it to, I don't recommend it to patients who I know that have anxiety or anything like that, because although the studies don't bore out, some people are what we call hair aware patients. Doesn't mean that they haven't got anything wrong, but they are, that's everything that's going on. The lady I was speaking to first, her healthy attitude to it, not everyone can be like that, but some people it consumes them 24/7. So somebody like that I may not want to, because there are some people reporting that they've felt more depressed on it. The papers don't bore out. They're saying that it's really, those people would have been like that. And for men, premature ejaculation on this, so they have to also monitor that. So there's things you have to weigh up before you decide to go down that route. That said, still a good option.
So someone like me that suffered with breast cancer, would I be able to take something like that or use something like that?
We'd have to look at your hormones, whether it was estrogen levels and androgen, because some of them it's not going to be a good idea at all. Okay. For you to do that, but the minoxidil should be okay.
Okay.
What about if you have blood pressure? Can you take the minoxidil still? And you're medication?
I would probably want your doctor to say yes, it's okay.
Okay.
Hi, sorry, can I ask a question?
Yeah.
If you have a, because I had a hysterectomy 25 years ago, and I was at HRT for about 10 to 15 years. Yeah, as everyone talk about that, my middle has always been thinner. I've got a lot of hair. Well, I chopped it off now in the last few months. I decided to go short this way and stop coloring my hair as well, which I've been doing for more years I can remember, since I was in my 40s, now I'm in my mid 60s. So I think it's a combination of all this. But I was wondering if, because when I had a full hysterectomy with no estrogen, no eggs. So therefore I had HRT for 10 to 15 years. Would that be, would that also affect, you know, a bit of hair loss, especially in the middle bit?
Yeah. Normally
Okay.
it's more at the front. I find, from my own experience, it's mainly Asian women that get the sort of thinning. I've discussed it with different dermatologists, and there's one lady, Professor Maria in Brazil, and she's adamant that this middle that we term as CCCA is also a variant of genetic thinning in Black women. You know, even though it's a rogue gene, she still believes that this is the way it presents in Black women. Because again, we have these issues here in Brazil. It's also huge. Because culturally they have, you know, the whole thing with relaxing and having straight hair, and the colorism is huge over there. So they're doing all the things that's triggering this kind of condition as well. But yeah, hormones will definitely play a part with it.
Okay. Well, I like my short hair now. Wash and go.
Right.
No hair dryer, no nothing. Wash and go, shower, in, out, towel, wipe it, and gone. So I love it now.
Yeah. There you go.
Yeah.
Every cloud has a silver lining, as they say. Yeah.
True. I was going to ask Kevin in terms of the men that you see, because we've not got many men on here. I think you're the only one, are you? Yeah.
Yes.
The
other young man, he just sent me a message stating that he wasn't able to come because he had something to do with his son of emergency.
Okay.
So I didn't get a chance to cut in and say that. I do have some questions I wanted to ask here. Is like, we have customers, you know, in my store, we do a lot of loxing, and we have ladies who come in with the sides here thinning away a lot. It's getting worse. Some of them tend to come in and ask you to shave it off and stuff. But what we was just chatting about, that's in medicine. Do you think I should send them on to a dermatologist so that they would be able to get advice to know how to move forward with this case? For a lot of them, that's
definitely to a trichologist.
A lot of them. A trichologist, all right.
More than
because a lot of them come. Yeah, a lot of them come into the store, even men.
Yeah.
I've cut people with locks, their hair off, but because of the tension of twisting every 2 weeks or so, it damaged the scalp.
Yeah.
So that's another problem too. So these people, they keep asking me, we try using different things that people are selling and stuff, but it's not working, you know? So I think you could actually see the parts that damaged. It's shining. It's shining.
The shiny, pay attention to the shiny.
Yeah.
Because the shiny is telling you that this is active.
Yeah.
Whenever you get a scalp and it's shiny, it's telling you it still hasn't finished burning out yet.
Yeah.
And we use a device. There's different ones. And when you put this on, you're able to see under the skin. So we put that on, and then you can see whether it's scars or not. Yeah, you can see underneath. But what I wanted to say with the men, what we see a lot of is things like discoid lupus, dissecting cellulitis. So you would get a lot of men, particularly with that folliculitis, with the bumps on their head.
Yes, we do, especially to the back part. The back part. So what I tend to explain to barbers is sometimes they use the very sharp clippers to the back of these gentlemen, and I always try to tell them, don't rub it, just pass it across, because that area is a very tender area. So it tends to break out into like big keloids and stuff eventually. Never grows back, you know?
Yeah.
Very hard to treat, you know?
Yeah.
So that's a big problem in barbershops. It's a big problem. What do you recommend for that?
Yeah, no, definitely. They need to be referred because it could be a deep, this is where nutrition comes in a lot. because it's normally some sort of bacteria in there, and it may be that I'll do work with probiotic or prebiotic, depending. Also the management, what they're washing with. If you speak to any trichologist, one of the things that we're big on is not oiling the scalp.
Right.
But I want you to hear me out first. Hear me out.
Yeah.
Because this always raises questions. When you don't have a problem, it's okay. Do whatever works for you.
Yeah.
You know?
Yeah.
But when you have a problem, you have to change the routine.
That's right. That's right.
Sometimes the oil on the scalp can cause even more issue.
Right.
The second thing, and hear me out, you need to be washing your hair a minimum at least once a week.
Right. Right.
Even if you can't get to it because it's in braids or locks, get a flannel and wipe the scalp.
Rub that area, clean it. Yeah.
Wipe it, clean it. Yeah. Put some shampoo on, wipe it off and do it.
Yeah.
Because the build-up will cause so much problems. But for some reason, I don't know where it got lost. Well, you know, this idea that we don't wash our hair for 2, 3 weeks, 6 weeks. For some people, it's not a problem. They're not going to have
some
any
people
effect.
do it for months. Some people months before they come back in to wash their locks, you know.
Yeah.
They don't even get in between there because there's a technique you could use and even wash your locks without taking it out. You understand? Your styles. They don't do anything. And that is damaging your scalp.
Yeah.
Because if you do
100%.
decide to take off your locks one day, you're going to be seeing that damaged spots, those areas damaged because they're not being fed. You need to have water and probably Vaseline, I recommend. You know, natural things, nothing with too much chemicals and stuff. That's to keep your skin moist, you know?
Yeah.
So things like that, I recommend to the customers when they come through the door, you know? Natural products, aloe vera and Vaseline, you know? Natural things that we grew up on, coconut oil. These things, they work for us. They work for our skin, not just here, you know? So we stick with that. Yeah, but was quite wanted to ask that question because there's so many people come through that door with the sides, the ladies especially. Some without even locks, they're losing a lot of hair on the sides of the head.
Yeah.
Very thin.
So it will always go here. This is the recession area. If it's temporary loss, it's always going to show up here anyway. And if it's iron, it's going to show up here, and then that can recover. It could be traction. It could be the frontal fibrosing. It could be any number of things.
Anything. Yeah, but they have to go and get it. Yeah.
Yeah. One thing, can I just ask everyone, with the aloe vera, this is the problem. In this country, because the humidity is dry, if you have a problem, I'm not saying this if you've got normal scalp, I'm just saying if you've got irritation, sometimes it's best probably to not put it on, because on contact it feels beautiful, but once it dries out it can cause more irritation. The same with the oils, same with like Vaseline. Funny enough, the best thing is use something like an aqueous cream if it's dry. It's dry.
Natural,
so like you know, like an E45, one of these, you're better off with that because they're hypoallergenic.
All right.
You're better with something like that, but just be careful. But I'm talking about if you have a problem. If you don't have any problem with your scalp, then all good.
Yeah.
And not the hair, you know, I'm talking about just the scalp itself.
Yeah, the scalp.
Yeah.
Yeah. Thanks for that advice. Yeah. So very
Shirley,
informative.
before we go, can you put your details in the chat so if anybody wants to contact you directly, they can?
Yeah.
Come to your office or whatever. Put your office details or your phone number, please.
Okay. Thank you for that. My name's Shirley McDonald, as you can see on there, but if you Google my name and you put hair, I'll come up anyway. And I've got, if you go on the website, if you go on the website, you will see my the booking, the hair and scalp clinic. You can just book in online. Trichology does cost. It is private. There's no medical insurance or anything like that. But I love what somebody said the other day. They said, how do you justify that? And we said, it's a bit like your car. You wouldn't leave your car. You have it MOT'd and serviced every year. It's the same with your body, because the hair is a reflection of what's going on.
While Shirley's typing her details, are there any more questions before we sign off?
Han, can you send it round? Because I'm on my phone. I couldn't get on any other line, so I can't.
Okay, so once she puts it on, I'll send it. I'll send it out to all those.
I'll put it on to Phil, I think. Hold on. I think I should have put it to everybody, shouldn't I?
Yes, please.
It said to Phil. How do I get to? Oh,
yeah, go to
I got it to everyone. Yeah. I'll just copy and paste.
And did you say that you was a nutritionist as well? Do you do diet?
Yeah, it goes hand in hand, but I'm not a qualified nutritionist. I've trained, I've done a diploma in nutrition, done it for years, but I'm not that's not my main speciality, but it comes as part of our training, and I've done more in addition. And if there's things that I can't do, then I'll refer on, as I would even with dermatology. If there's medications that you need, I would write the letter to your doctor and ask for referral.
Thank you. It's been wonderful. Very helpful and informative. Thank you.
Thank you for having.
Yes, thank you.
Thank you to all my speakers, and Shirley, thank you so much. I think this is something that we were really needing, someone that can educate us on
thank you.
treatment, and for all those who came on today, thank you very much.
Yeah, thank you, Hannah, for putting that on.
Thank you.
Very educational. It's good.
Thank you very much.
Yeah, thank you.
Thank you.
Thank you, everybody. Thank you for joining.
Thank you, Hannah.
You're welcome. Have a lovely evening, everybody. Shirley, we'll catch up. Thank you very much, Shirley. Appreciate it.
Thank you, everybody. Good night.
God bless you. Bye-bye. Bye.
Bye.